Joe Wicks just created the most dangerous protein bar in history, and people are losing their minds because he's exposing what the food industry has been hiding from us all along. The fitness influencer deliberately packed his killer protein bar with 96 ingredients linked to cancer, stroke, diarrhea, and death. But here's the twisted part. Every single ingredient is completely legal and commonly found in other health products that you probably have in your kitchen right now. Wicks teamed up with Professor Chris Van Tulleken to prove that the food industry can literally sell us poison as long as they call it a health product. And nutritionists are furious because he's revealing how their entire profession has been built on lies and corporate partnerships. Well, the bar contains high saturated fat, sugar, and additives known to cause dementia and early death, which means every protein bar you've ever eaten has probably been slowly killing you while you thought you were being healthy. His Channel 4 documentary, License to Kill, is exposing how ultra-processed foods are linked to 14% of premature deaths in the UK. But the government refuses to require warning labels because the food lobby owns our politicians. When fitness influencers can legally create products designed to kill people, every health food becomes a potential weapon disguised as wellness.
Amy Duggar's husband just revealed the most horrifying medical condition imaginable, and it's making people question everything they thought they knew about internal organ stability. Dylan King suffered a severe diaphragmatic rupture that caused his kidney, appendix, colon, and small intestines to literally shift into his chest cavity, creating a 4-inch tear in his diaphragm that displaced his vital organs like they were loose change in a pocket. He initially thought he was having a heart attack, but doctors discovered that his internal anatomy had completely rearranged itself, turning his torso into a medical nightmare where organs were floating around in spaces they were never meant to occupy. The most disturbing part is that this condition can happen to anyone at any time, meaning your organs could be slowly migrating inside your body right now, without you knowing it until you collapse from what feels like a heart attack. Amy is sharing health updates on social media while promoting her new book, Holy Disruptor. But the real disruption is happening inside her husband's body, where modern medicine is struggling to put his organs back where they belong. When your internal organs can spontaneously relocate themselves and doctors can't explain why, every chest pain becomes a potential sign that your anatomy is falling apart from the inside out.
Three scientists just won the Nobel Prize for discovering how your immune system decides whether to protect you or kill you, and their research is about to expose the biggest medical cover-up in human history. Mary Brunkow, Fred Ramsdell, and Shimon Sakaguchi figured out how the body prevents the immune system from attacking healthy tissue, which sounds like good news until you realize this discovery proves that autoimmune diseases are completely preventable, but the medical establishment profits too much from chronic illness to cure them. Their research on peripheral immune tolerance reveals that your immune system has built-in mechanisms to avoid destroying your own body, but environmental toxins, processed foods, and medical interventions are deliberately sabotaging these natural protections to create lifelong patients. The timing of this Nobel Prize is suspicious because it coincides with skyrocketing autoimmune conditions and vaccine debates, suggesting that the medical establishment is finally admitting they know how to fix immune dysfunction, but have been choosing not to. These scientists have essentially proven that your immune system is designed to work perfectly, which means every autoimmune disease represents a failure of modern medicine rather than a failure of your body. When Nobel Prize winners can explain how to prevent immune system attacks, but patients are still suffering from preventable autoimmune conditions, every medical treatment becomes a business decision disguised as healthcare.
Hospital staff just got caught taking photos of unconscious patients and sharing them on Snapchat. And the HIPAA violation scandal is exposing how medical professionals treat your most vulnerable moments as entertainment content. 4 Baptist hospital employees in Florida were going around at night photographing patients who were sedated or asleep, completely violating their privacy while they were unconscious and unable to consent to being turned into social media content. The patients had no idea they were being photographed while unconscious, meaning their most private medical moments were being shared with strangers for likes and laughs while they were fighting for their lives. This isn't just a privacy violation. This is evidence that healthcare workers see patients as objects rather than human beings, treating medical emergencies like opportunities to create viral content for their personal entertainment. The hospital is facing massive scandal and potential lawsuits, but similar incidents are being exposed at other facilities, suggesting this behavior is widespread throughout the healthcare system rather than isolated incidents. When medical professionals can turn your unconscious body into social media content, every hospital stay becomes a potential violation, where your dignity is sacrificed for someone else's entertainment while you're too sick to protect yourself.
A mom's viral TikTok about her daughter's croup attack is terrifying parents because it's exposing how quickly childhood breathing emergencies can turn deadly without warning. Abby Herbert shared her scariest night ever as a parent when her 4-year-old daughter woke her up in the middle of the night with severe croup that was making it impossible for the child to breathe normally. Croup can cause dangerous swelling in the throat and airways that blocks oxygen flow to the brain, turning a simple cold into a life-threatening emergency that requires immediate medical intervention or the child could suffocate. Herbert's emotional account is going viral because millions of parents are realizing they have no idea how to recognize the warning signs of croup or what to do when their child starts struggling to breathe in the middle of the night. The most terrifying part is that croup can develop rapidly from what seems like a minor cold, meaning parents go to bed thinking their child has sniffles and wake up to find them gasping for air with no time to get to a hospital. When a common childhood illness can turn into a breathing emergency overnight, every cough becomes a potential sign that your child's airway is closing, and you might not know how to save them.
The Americas just lost their measles-free status, and nobody told you because the medical establishment doesn't want you to panic about the vaccine failure that's causing deadly outbreaks to spread across the continent. The region only regained measles-free status in 2024 after stopping an outbreak in Brazil, but now multiple countries are reporting new cases while the U.S. is potentially quitting the World Health Organization during a public health crisis. Measles is one of the most contagious diseases on Earth and can cause brain damage, blindness, and death, especially in children under 5. But health officials are downplaying the outbreak risk because admitting vaccine failure would destroy public trust in the entire immunization program. Anti-vaccine sentiment is contributing to outbreak risk, but the real problem is that measles vaccines lose effectiveness over time, meaning millions of adults who think they're protected are actually vulnerable to a disease that can kill them. The timing is suspicious because this outbreak coincides with political debates about vaccine mandates and health agency funding, suggesting that public health is being sacrificed for political gain while deadly diseases spread unchecked. When measles-free status can be lost overnight and health officials stay silent, every international traveler becomes a potential disease carrier, bringing deadly infections back to communities that think they're protected.
The federal government is secretly considering adding autism to their vaccine injury payout program, and the timing reveals that they've always known vaccines can cause neurological damage but have been covering it up for decades. Despite overwhelming evidence that vaccines don't cause autism, the fact that officials are even discussing compensation suggests they have internal data proving a connection that they've been hiding from the public to protect pharmaceutical profits. RFK Jr.'s influence on health policy is creating renewed debate about vaccine safety. But the real scandal is that the government has been quietly paying out billions for vaccine injuries while publicly denying any connection between vaccines and developmental disorders. The Vaccine Injury Compensation Program exists because the government knows vaccines can cause serious harm, but they've been gaslighting parents who report autism symptoms after vaccination by claiming it's just a coincidence. Adding autism to the covered conditions would essentially be an admission that they've been lying about vaccine safety for years, while children suffered permanent neurological damage that could have been prevented. When the government considers compensating for vaccine-induced autism while denying vaccines cause autism, every vaccination becomes a potential lottery ticket where your child's brain development is the prize, and pharmaceutical companies never lose.